Today we are talking about a condition that has pushed many to their limits but also sparked resilience and strength: endometriosis. This condition, often shrouded in mystery, affects millions globally, yet remains misunderstood. In the next few minutes we'll shed light on endometriosis, who it affects, its possible causes and associated symptoms. We'll also discuss why, despite extensive research, there's still no cure, and explore the various treatment options available. Picture this. What if you could better manage your endometriosis symptoms? Or, what if you could understand your condition better and educate those around you? These are not mere hypotheticals, but potential realities that await you as we delve deeper. So, buckle up and stay tuned as we delve into the world of endometriosis. Endometriosis, a word that might sound like a mouthful, but it's a condition that affects millions worldwide. Now, what exactly is endometriosis? Imagine the wallpaper in a room. It's there to decorate, right? But what if that wallpaper started to appear on the ceiling, or even on the floor? It would seem out of place, wouldn't it? That's similar to what happens in a body affected by endometriosis. In this case, the wallpaper is the endometrium, the tissue that lines the inside of a woman's uterus. Typically, the endometrium thickens and then breaks down and bleeds with each menstrual cycle. But in endometriosis, this endometrium starts to grow outside the uterus, where it shouldn't be. It can grow on the ovaries, fallopian tubes, and even on the intestines or bladder. Just like the misplaced wallpaper, it can cause a lot of problems. You see, this endometrial tissue that's grown outside the uterus still acts like it should within the uterus. It thickens, breaks down, and bleeds with each menstrual cycle. But there's a catch. Unlike the endometrium within the uterus that leaves the body as a period, this tissue has no way to exit the body. This can lead to painful cysts and adhesions. Endometriosis is a common condition. It affects about 1 in 10 women of reproductive age. However, it's often misunderstood and misdiagnosed, leading many women to live with the pain and complications of the disease for years before receiving proper treatment. The exact cause of endometriosis is still unknown. Some theories suggest that it could be due to genetic factors, immune system disorders, or even retrograde menstruation, which is when menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of out of the body. Endometriosis isn't just a condition, it's a life-altering journey. Despite the challenges, many women with endometriosis live fulfilling lives. They are warriors, confronting and overcoming this condition each day. Their strength and resilience are truly inspiring. You may be wondering, who does endometriosis affect, or what causes it? Endometriosis is a condition that primarily affects women during their reproductive years. Picture a room full of 20 women. Statistically, 1 or 2 of them will have endometriosis. Yes, it's that common. However, it's worth noting that it can affect any female from the onset of her menstrual cycle, up until menopause, and sometimes even beyond. Now you might be thinking, why me, or why my loved one? The truth is, we don't have all the answers yet. But there are a few theories that might help explain why some women develop endometriosis. One theory is that endometriosis might be linked to a genetic predisposition. Think of it like having curly hair or blue eyes. It might run in your family. If your mother, sister, or aunt has endometriosis, it's possible that you could have it too. Another theory is something called retrograde menstruation. This is when some of the tissue that is shed during your period flows back through your fallopian tubes and into your pelvic area instead of leaving your body. This tissue can stick to your pelvic walls and surfaces of your pelvic organs, where it grows and continues to thicken and bleed over the course of your menstrual cycles. There's also a theory that suggests that certain immune system disorders could make some women more prone to developing endometriosis. It's like having a security guard who's supposed to keep trouble out but accidentally lets some in. Though these theories may sound complex, they all revolve around the same basic idea. Endometriosis occurs when tissue similar to the lining of the uterus begins to grow outside of the uterus, causing pain and sometimes fertility issues. While the cause isn't entirely clear, awareness and understanding are key in managing endometriosis. And remember, you're not alone in this. There's a whole community out there ready to offer support and share their experiences. So, let's keep the conversation going. Endometriosis is a silent invader, often masquerading as other conditions. It's a shapeshifter, its symptoms varying widely, making it a tricky condition to pin down. The primary symptom? Pain. And not just any ordinary pain. We're talking about the kind of pain that makes even simple tasks feel like climbing a mountain. Let's delve a little deeper. One of the most common symptoms is pelvic pain, especially during menstrual periods. It's not just your regular cramps. It's like your regular cramps took a trip to the gym, bulked up, and came back with a vengeance. This pain can begin before your period and extend several days into your cycle. It's persistent and it's debilitating. Next up, we have fertility issues. Around 1 in every 3 women with endometriosis may have trouble getting pregnant. It's an unfortunate reality for many, but remember, it's not a definite. It's a potential complication, not a guaranteed outcome. Now let's switch gears and talk about something that isn't discussed nearly enough: the emotional and mental health implications of living with endometriosis. Living with constant pain is a heavy burden to bear. It can lead to feelings of frustration, depression, and anxiety. It's like a shadow, constantly looming, affecting every aspect of your life. There are also other symptoms that may not appear related to the reproductive system at all, like lower back pain, intestinal pain, and even fatigue. You see, endometriosis has many faces, and it can show up in areas you least expect. So how do you know if what you're experiencing is endometriosis? It's a tough question, but not an impossible one. Look for patterns. Are your symptoms worsening with your menstrual cycle? Are they affecting your daily life? If so, it's time to have a conversation with your healthcare provider. Recognizing the signs is the first step towards reclaiming your life from endometriosis. It's a journey, and like any journey, it begins with a single step, and that step, it's understanding. Understanding the signs, the symptoms, and the potential complications. It's about taking control, one day at a time. While there is currently no cure for endometriosis, hope is far from lost. Let's dive into the sea of treatment options available today. Remember, managing endometriosis is not a one-size-fits-all approach. It's about finding what works best for you. Our first stop is the realm of medication. Hormonal therapies are often the first line of defense. Birth control pills, patches, or vaginal rings can help regulate hormone levels and reduce pain. Gonadotropin-releasing hormone, GnRH, agonists and antagonists, on the other hand, can stop menstrual periods and lower the amount of estrogen in the body, thereby shrinking endometrial tissue. Another avenue is pain medications. Over-the-counter NSAIDs like ibuprofen can provide relief from the discomfort that endometriosis often brings. For more severe pain, a doctor may prescribe stronger medications. Now let's move to the surgical side of things. Conservative surgery, for example, removes or destroys endometrial growths while preserving the uterus and ovaries. It's an option often considered by those wishing to become pregnant in the future. On the other hand, we have radical surgery, like a hysterectomy, which involves removing the uterus and possibly other parts of the reproductive system. It's a more drastic option, usually considered when other treatments haven't worked, and if you're not planning on becoming pregnant. But remember, the decision to have surgery is a significant one, and should be made in consultation with your healthcare provider, considering all the benefits and risks. Beyond medication and surgery, lifestyle changes can also play a role in managing endometriosis. Regular exercise, a balanced diet, and stress management techniques can all contribute to overall well-being and symptom management. In the end, the best treatment plan is a personalized one, developed in partnership with your healthcare provider, considering your symptoms, plans for pregnancy, and overall health. Remember, every step towards managing your symptoms is a victory. So, keep exploring, keep learning, and most importantly, keep fighting. You're not alone on this journey. Navigating the labyrinth of endometriosis can be daunting, but you are not alone. Throughout this video, we've peeled back the layers of this complex condition. We've explored how endometriosis is a persistent ailment that affects many, delved into the potential causes, shed light on its symptoms, and highlighted the absence of a definitive cure. However, we've also underscored the various treatment options available, including medication and surgery, which can help manage the symptoms and improve quality of life. Remember, knowledge is power. The more you understand about endometriosis, the better equipped you are to navigate your journey. If you have personal concerns or symptoms, we encourage you to seek medical advice. Thank you for watching. Please subscribe to our channel Vigor Vault and share this video. Don't forget to leave a comment about the most helpful tip or suggest a topic for our next video. Stay strong and keep fighting.